What's up, guys? So our two questions from today have to deal with Meckels, diverticulum, and intessuception. So before we approach the questions, let's just quickly speak about Meckels and intessuception. Meckels is a remnant of the vitelline duct that stays back, and usually this is painless. Do not forget this painless part. Then we want to remember the rule of twos for Meckel's diverticulum, which is a 2-year-old, two types of tissue, which is found in the diverticulum itself. So they can give you a biopsy of the ileocecal junction or a few feet away from it, which would also be 2 feet away from it or 2 centimeters away from it. And they can say that there is gastric or pancreatic tissue present, and that right away should tell you that this is also a Meckel's diverticulum. All right. Yeah, the painless, don't forget about the painlessness. Also, in a less than 2-year-old or a 2-year-old, a Meckel's diverticulum is the most common cause of blood loss. So in a 2-year-old, they can ask us that a most common cause of iron deficiency anemia. In Meckels would be, in a less than 2-year-old would be Meckels. All right. Iron deficiency anemia. Awesome. So knowing this about Meckels now, we can approach question number 1. So there's a 2-year-old boy presenting with painless changes in bowel habits, and there is fecal occult test positive. Right away, Meckels is our answer. So how do we differentiate the Meckels from intessuception? So biggest thing would be that intessuception would present to us with acute cyclical colicky pain. But remember pain, easiest thing. There would be tenderness. And over here, so what is intessuception actually? Intessuception is telescoping of intestines. So what happens is that, let's say this is the cecum going up, and this is your ileum all the way here. So what will happen is that this cecum, this ileum will go into the cecum. All right, so of course, you see that would be kind of an intessuception now. So there is telescoping of the intestines. When you see this on an ultrasound, you see this as a target sign. So they can define both, either telescoping or the target sign. Main differentiating factor between this and Meckels, pain. Remember, Meckels is also a true diverticulum. Only one that's a true diverticulum. Zankers and diverticulosis are false diverticuli. Okay, knowing these two, now we can approach our second question. Our second question states that it is a 5-year-old boy, and he's presenting with acute colicky abdominal pain for the past 4 days, and it's progressive. There is melena present. Rebound tenderness is also noted. So now they're saying what the patient's diagnosis, we can figure that out to be intessuception. And now they're saying intessuception is associated with which condition. So there's a couple things here. We can rule out C because that would be, we would apply rule of twos. It's also painless, not over here. Berger's disease, that's thromboangiitis obliterans. Tau, this person is not a smoker, nothing like that, and also not claudication, and he's also very young, so not that. That leaves us with IgA vasculitis and Crohn's. So in Crohn's disease, Crohn's is associated with intessuception, but it is ileoIleal intessuception. All right. The most common intessuception found in children is ileocecal, and then ileocecal intessuception would be seen with Henoch-Schönlein purpura or IgA vasculitis. So H SP, hinge pain for arthritis, stomach pain or abdominal pain, and now you want to remember intessuception, and then purpura. So for us, our answer should be B. And that's it. Thank you.